episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome, everybody, again to another episode of our show, bringing you another fascinating guest today who is helping to create a better tomorrow for so many people. We are honored today to be joined by Dr. Charlotte Yeh, who is Chief Medical Officer at AARP Services, where she works with the various independent carriers that make health-related products and services available to AARP members, ultimately to identify programs and initiatives that will lead to enhanced care for older adults and healthy aging. AARP, for our non-US listeners, formerly known as the American Association of Retired Persons, is a US-based interest group focusing on issues affecting those over the age of 50. And as of 2018, it had over 38 million members around the country. Dr. Yeh has more than 30 years of experience in the healthcare domain, both as a practitioner and a chief of emergency medicine at Newton Wesley Hospital and Tufts Medical Center, as the medical director for National Heritage Insurance Company, a Medicare Part B claims contractor, and a regional administrator for the Centers for Medicare and Medicaid Services in Boston. Dr. Yeh is widely recognized for her commitment to and passion for the healthcare consumer. She's received numerous honors for her efforts on behalf of patients. As a healthcare leader, she has served also on numerous boards and committees throughout her career. Currently sits on the Blue Cross and Blue Shield of Massachusetts Foundation Board, Optum Labs Scientific Advisory Board, and HX360 Executive Leadership Advisory Board. She received her bachelor's from Northwestern University and her medical degree from Northwestern University Medical School, completed her internship in general surgery at University of Washington, and her residency in emergency medicine at UCLA. And we're honored to have her. So Dr. Charlotte Yeh, thank you so much for coming on our show today.
Thank you very much. I'm just delighted to be here.
We're delighted to have you. And, you know, I'd love to start things off, as we typically do, by handing you the floor for a little bit to talk a little bit more about the Dr. Charlotte Yeh story, because you've had an amazing journey so far. Talk a little bit about yourself, what got you interested in medicine to begin with, of course, aging, and a little bit of the journey to date. I think that'd be a great way to start things off.
Yeah, well, I just have to say I've been extremely fortunate to have had such an incredible journey through the whole healthcare ecosystem. Probably started at the age of 5 saying I wanted to be a doctor, mostly because my best friend got tonsillitis and we played doctor nurse all the time. And at that time, it never even occurred to me that women weren't traditionally going into medicine, you know, but that became my passion, my desire, and fortunately went on through medical school. So from there, fell in love with emergency medicine. And I love emergency care because it is probably the most democratic, accessible part of the healthcare system. It doesn't matter whether you're homeless, you're president of the United States, everybody at some point has an emergency, and we somehow see you through the emergency department. And it is an incredible nexus of what works in healthcare and what works in healthcare, or what doesn't work, more likely, and what doesn't work in the community. It's an incredible nexus of the healthcare system in the community. And I love that it is extraordinarily chaotic, crazy. Nobody wants to be there. And creating that order out of chaos is just delightful. I mean, you know, the angst and the stress, and creating calm, peace, and a pathway out. So I love the emergency environment. It's still very much of my my core, and everything I do, I can see the patients that I took care of. But after about 20 plus years in that, I said, you know, I kind of want to go upstream. So that's how I ended up working for a Medicare contractor for payment. So that's where you learn, if you perform a service, what goes in the black box and turns into $1 at the other end. And I have to say, you probably don't really want to know all those details and all, you know, the pieces to pull that through, and, you know, how do you make coverage decisions? And from there, I moved into CMS, Centers for Medicare and Medicaid Services, at the time of the stand-up of the Medicare Part D program. So I covered the Boston regional office, temporarily covered the San Francisco regional office, so really got a sense of sort of the policy. And now, as you mentioned, I work for AARP. I actually work in the business subsidiary, and I work on an initiative called Healthcare Transformation, which is how do we take the assets of an ARP that understands consumer and consumer insights and work with the companies, such as United Healthcare that covers the ARP branded Medicare plans, the hearing programs, the vision programs, the dental programs. How do we take their understanding of healthcare delivery and finance and collaborate? And could we not then improve the outcomes, the experience of care, and the affordability of care? So that's what I work on now. And what's not in this story, and this is, my professional path, but what's not in the story is in my 20s, I ended up slipping, injuring my back, was out of work for over 2 years and told I would never work again. I said, really? That's kind of crazy. So how do you pull yourself out of that? And then a little over 10 years ago, I was hit by a car as a pedestrian and literally had to relearn how to walk and was told I'd never walk without a cane. I now have learned to ski, bike, and scuba dive, which I never did before getting hit by a car to any degree. And then I've learned to be a caregiver. My mother was 90, ended up developing lung cancer in the midst of the COVID pandemic. And how do you care for somebody remotely during the midst of, the pandemic that we're still in? And then my sister-in-law came down with cancer as well and had to care and navigate her way through healthcare. And then my father, who is now alone, learning to struggle, a little bit early onset of cognitive impairment and caregiving for him as well, on a remote basis. So I like to say I've been a provider, a payer, a bureaucrat. Now it's all about us, the consumer, and our roles as people. How do we age and how do we care for others in this crazy world?
Absolutely. There's so many. It's a fascinating journey, Charlotte, and there's so many interesting themes in there. Obviously, we're going to be getting into some of those. You obviously show resiliency, which I know is a very hot topic for you. We'll be talking about, obviously, the caregiving component of aging, of healthy aging, which we don't normally think as much about. But one area that I'd love to start off with, because I know it's near and dear to you, and you spend a lot of time thinking about it, writing about it, is this broad topic of ageism, this stereotyping, discrimination against either individuals or groups of individuals based on age. Talk a little bit in general about how you, and then of course your team, thinks about the topic of ageism at AARP, and also some of the myths surrounding aging that we might normally just brush off, but wow, we can learn something from listening to the Charlotte Yates of the world.
Well, thank you for asking, because as you can tell, it's been a lived experience through this entire journey. So one of the most striking things as I started working for AARP and we were working on this collaboration, healthcare transformation, is could we actually improve the outcomes and affordability of, our Medicare beneficiaries? And what was so fascinating in that period was, one, people don't think about health and healthcare. It's not about your hemoglobin A1C. It's really about how do I live a better life and what are the tools to living better and more independently. I also learned that, so much of what we think about in aging is it's all about decline. And I learned that there were assets that came with aging. Did you know that after the age of 50, your happiness index tends to go steadily up? And even though 80 to 90% of people 50 and older experience some form of ageism, and we'll come back to that, or, discrimination against aging that they hear in the jokes, in a home, in the work setting, frankly, in the media, over 2/3 of people 50 and older said, life over 50 was better than I thought it would be. And I love the fact that in our Medicare beneficiaries, over half said, my health is better than other people my age. And there's even a study out there, because we think of, as you age, your health just simply declines. But there's even a study out there that sure enough, when you're 50, about 90% of people say, I have no health-related problems with work, limitations on my housework, et cetera. But how many of us expected at 85, 56% say, I have no limitations on my work or my housework based on my health. So it's not necessarily all about decline. And one of the most fascinating things when I worked in the emergency department is you could see two people, 80 plus years old, coming in, each with a broken hip. And I would look at person A and take one look and go, she is walking out of the hospital. And then I would look at the next person over and go, oh my goodness, this looks like the end of the road. Same fracture, same age, same clinical conditions. So I realized that maybe that negative view of aging is not necessarily real. And it turns out that, let's speak of technology, right? We always think, old folks, they don't know how to use technology, et cetera. How many of you know that 72% of people 50 and older bought new technology last year?
Yeah.
And they've spent 194% more on technology last year than they did the year before. That 65 and older is the fastest growing cohort of buying online now as a result of the pandemic. And something like 70% actually use multiple devices to stay connected with others and family. And in spite of that, less than 5% of media and marketing images show an older person using technology. And older adults and technology are 7 times more likely to be portrayed as negatively, not as independent, right? Yep. When you see an older person using technology or laptop or something, it's always somebody showing you how to use it. And yet, in fact, that's not the reality. 85% of people 50 and older actually own a smartphone. And 77% of people 70 and older actually have a smartphone. And that's not, so we really have to think about that difference of what it really means to age, and this common perception doesn't necessarily fit. And in fact, we found through looking at our Medicare supplemental plan members, about 40%, not surprisingly, have a negative view of aging, right? It's all around us. It's in the media. We have ARP studies that say 1/3 of people 50 and older have already internalized that aging means poor health, means loneliness, means isolation, all the negativity. And it turns out that 40% is associated or correlated, at least our early data, with a 33% higher healthcare costs.
Wow.
It could be costing us $63 billion a year in healthcare costs, potentially unnecessarily, because attitude matters.
Yep.
And so one of the things that we're learning in our process is if we can start to shift the thinking and talk about the assets that come with aging, well, smarter, a little wisdom, it turns out your vocabulary is better, your social lability, it goes down, your problem-solving skills go up, and it turns out that, there, even from the CDC in the pre-pandemic, if you actually looked at anxiety and stress by age bands, it goes down. It's highest, as young adults, and it continues to go down, into your 70s and 80s. And even during the pandemic, everybody's stress level and mental health, anxiety, and stress has gone up. But if you look at it by age band, those in the oldest age groups, go up less. So I think it's time to start rethinking that older adults can use technology. They've got wisdom, they've got relevancy, they've got skills to give back. So,
thinking about the example you gave in the surgical suite, those two women, through my lived experience, are my mother and my mother-in-law, because my mother was the one, when she broke her hip several times. She wanted to be up out of that bed the next day with the walker, then they came the next day and out of the hospital. While my mother-in-law, she could take a few months just lying around. What was me? And that story resonated with me a lot as you're going through it. And I think this is a great time to segue into some of what you referred to as, right, as sort of the secret sauce of this personal resiliency. You talk about so-called personal determinants of health, talk about the social determinants of health on other shows, and through your work at AARP Services have really outline these three very important components of what makes up this personal determinants that support individual resiliency, namely the three Ps like our show, but purpose, possibility, and people. Sean, take a little time to walk us through some of what you've learned on this front. I think this is an extremely important message.
Yeah. So I just want to throw this out there that we ought to be, kind of reframing how we look at health. So all of us, for decades, years, we all talk about the healthcare system, right? We can change any joint in the body. We've got extraordinarily drugs. We've got, phenomenal technology and new diagnostics, yep. But it's not enough. And we are going to sink, under the cost if we continue to think that, the healthcare system is going to solve for everything. And in fact, by the way, 85 and older is the fastest growing population. 100 and older is the second fastest. So there really is an imperative. And nowadays, there are more people over 65 than under the age of 5. And by 2030, there are going to be more people over 65 than under the age of 18. So there is a real imperative that we have to address it. So the healthcare system can do phenomenal things, but it's not enough. Right. And then you mentioned we now have the social determinants of health, transportation, housing, education, and it's all these community resources that we know are also important for accessibility, for equity, et cetera. And yet that's not going to be enough. And so I'm suggesting that there is a third pillar that I call the personal determinants, which is what can we do with individual skills, individual resources, that because life is going to challenge us every single day. Okay. That's just human nature. So if we're going to be challenged, how do we bounce back? How do we cope? And that's resiliency. In fact, we did a study taking a look at protective factors, that allow you to cope, manage stress, et cetera. And we just took a look at 5: purpose, optimism, locus of control, social connection, and resiliency. And it turned out it didn't matter which one you had, but the more you had, the less anxiety, the better your self-reported physical health, the less functional limitations, the lower the rate of depression. And for every one that you added, you saved healthcare costs of $1,356 on average per year per person. So it's not just the outcomes and how you feel, but it's also could affect how we spend our money in healthcare. So we started to explore this in a collaboration, with United Healthcare and AARP Services. And as we started to dive into what makes this difference, there are many, many things that go into resiliency, but the 3 that we thought were the most meaningful and could be changed were 1, a sense of purpose, what gets you up in the morning. 2, I call it possibilities, but it's really optimism and that positive view of the assets that come when you age. And the 3rd was the importance of social connection. So it turns out if you have a strong sense of purpose, you have fewer heart attacks, fewer strokes, better cholesterol, more preventive services, fewer nights in the hospital, and fewer doctor visits. And we have about 35% of our population, Medicare population, that are low in purpose, and they cost us 12% more per member per month. And how important it is to have meaning and what gets you up in the morning. Right? How many people, go on and think, I'm bored, I'll go up the career ladder, and then I'm going to retire, and then find themselves with nothing to do, with no future, and you watch their health start to decline. So what gets you up in the morning is extremely critical. And it could be as simple as, I'm getting up to have my bowl of ice cream today. It doesn't have to be, I'm saving the world, you know. The second thing is what I call the possibilities. We talked about that age, how important it is to be age inclusive. So it turns out if you have a positive view of aging, you're 44% more likely to fully recover from disabilities. 80% reduction of cardiovascular events. It's associated with lower risk of dementia. You live 7.5 years longer, 55% lower hospitalization, and as I said earlier, potentially 33% lower healthcare costs, or we could save as much as $63 billion in healthcare services. And then the last is social connection. And that's been all over the news. You know, when I first started talking about loneliness and social isolation back, you know, like in 2015 or so, people said, what are you talking about? I said, look, our studies show that if you are lonely, it is the single biggest predictor of dissatisfaction in healthcare. The providers, and we all talk about health literacy, and we talk about depression, but who's talking about loneliness? You know, it's the big elephant in the room. So, you know, and we've now learned that loneliness has the equivalency of 15 cigarettes of smoking, you know, a day in terms of risk factor, you know, mortality. So I don't need to go into all of the, you know, risk factors between loneliness and social isolation. By the way, there's a distinction. Loneliness is how you feel. Social isolation is the objective measure of how big is your network. So you could have lots of friends and be lonely. You could have no friends and not be lonely. So they're very distinct. They're both impactful. And obviously the ones who are both isolated and lonely are the ones with the highest healthcare costs and highest risk factors. So as I said, I call these the 3 Ps in the personal determinants of health: purpose, people, and possibilities. If you have a sense of purpose, something that gets you up in the morning, you've got people to do it with or who can support you. Your possibilities for tomorrow are endless, right? You can be 80. Who says you can't laugh and giggle, you know, when you're 85 years old on a daily basis? Who says you can't be fashionable when you're 85? Who says you can't be thinking about what you're contributing back? There is this phenomenal woman at a local assisted living. You know, I live in the Boston area, and she's on all these panels of, you know, older folks giving advice to companies and technology, et cetera. She's 97. And I love the fact that she's on the panels and she's been working with technology companies to give them. And she said, you know, things don't work as fast and you're not quite, you know, as quick and responsive, you know, and you don't remember things quite as well, you know, as you get older. So you really want to start early. So I would recommend, if you're going to work with a company in the technology and help them, give them advice, start at least by the time you're 95.
Oh, that's wonderful.
And so that's the inspiration, right?
Yeah, absolutely.
You know? Keep your brain active, you're exercising, you're eating well, you're meeting people, and you're staying social. You know, how can you not make the most of the life of what you have?
Really. Charlotte, you, in addition to your many responsibilities at AARP, you know, I've noticed, you know, over the years, I've seen you sort of on the conference circuit, looking at different age technology, elder care technologies, and so forth. And you've extensively published on some of these tools and how they help potentially impact the 3 Ps. And I just love if you could talk about a couple of them and you know, connecting to this theme of resiliency and social connections. You recently published a paper on the ability of animatronic pets to help well-being and improving loneliness, improving well-being. in these folks. We did an episode last year where the theme was virtual reality, and it was surprising. You put a virtual reality goggles on someone that's 85 that's never been to Borneo or whatever, and they have a great vacation in the virtual reality. It's surprising how well they take to it. Talk a little bit about some of what you found related to this particular paper, if you would.
Yeah. So, in our search for, bringing resiliency, it's nice to identify this, but can you actually offer people things that could make a difference? Can you actually move the needle on purpose, on social connection? Can you bring back the joy of life and move the needle and improve our total emotional well-being? So we found that actually there are things that can work. So we've tested a variety of interventions, and one you mentioned were these animatronic dogs and cats. They were designed originally for children that were now adapted to adults. So, the cat can purr, you can feel it purr, you can sit on the lap. You've got dogs that will bark, follow. I mean, they behave like dogs and cats as opposed to, just a little stuffed animal. And what we found was when we gave these to people who were lonely, that it improved their sense of well-being. And what was interesting, it wasn't so much that they were playing with the pet or the animal. What it was is it became a catalyst almost. So there was one woman who had the animatronic cat that she would take to a restaurant where she always ate alone. Mm. Now people would come over and say, "What is that?" They'd start a conversation, and it became a conversation spark. If you talk to the people who had them at home, because they couldn't get out, and families that came by, they became a way to have a conversation, to have quality, to play, with the dog and cat. It was like having the dog yard on your lap, as well as giving some comfort. And then for those with cognitive decline, it was reminiscent. They couldn't take care of a pet. They couldn't take care of one, but now they had something that would remind them of the dog and cat. So there are a number of states all over the country that have actually purchased some of these cats and dogs to give to their lonely elder citizens, particularly during the COVID era when everybody was so isolated. So that was, one of our, more enjoyable, fun studies that we did. We are, testing a variety of social connection. Can we build tools, how to problem solve? Because, if you've been lonely for a while, or as you age, you start losing friends, family, spouses, people pass on, you might have lost some of those social skills. Mm-hmm. So we are looking at interventions of how do you create the social skills? How do we create cross-generational connections? There are a number of companies, that are working on that. How do we build a volunteerism? There is a program called the Experience Corps, which is ARP volunteers that are reading to third graders. And we noticed, and of course the studies have shown, they're not teaching them to read, they're just volunteering to read and create a joy of reading in third graders. And the third graders go on with better education, more likely to finish school, more likely to have careers, et cetera. And what we're also learning is for the older adult volunteers, they have a sense of purpose, right? Yep. They now are important. They have a relevant role to play in society. And that sense of purpose, we found there's actually one study out there that even if you only volunteer like 2 hours a week, 100 hours a year, that you have better physical outcomes, lower depression, better emotional sense of well-being. And so it doesn't take much to really change, how you might live as you age.
Yeah, we had we were talking recently with folks from AmeriCorps Seniors on this very topic, and that was I'd say another striking component there of just how, as you were just mentioning, that small amount of time with a child, just going through homework, you're talking about the day. It made all the difference in the world, and the self-reported component of that is just it's really I don't think that can be overstated, and I'm glad you brought that up in what you're finding.
Yeah, and if I were to talk to companies, innovators, digital health, developers, right now I feel like everyone thinks about designing for old, right? I got to figure out, how do I prevent a fall? How do I notify people when somebody's fall? It's all about designing for old.
Yeah.
But if you really want to be successful, it really should be this design for all.
Yep.
Think about curb cutouts, that were designed for people in wheelchairs. Who uses it more than anybody else? Mothers with strollers, business people pulling their suitcases, right? It is convenient for everyone, because if you are not singled out and showcase for what you can't do, but it turns out that making it easier for you makes it easier for everyone. Levers on doors instead of round door handles work. Yep. You don't want to, but work as well for 3-year-olds as they do for 83-year-olds. Maybe we don't want the 3-year-olds opening the doors, but just think about that. Design for all. Yep. As I said earlier, why are we not designing for joy and laughter? Yep. You talked about virtual reality. There was a wonderful company called Rendeavor that used virtual reality for dementia and Alzheimer's. And one of my favorite stories is they have a video of a woman with severe dementia who hadn't walked in several months. And they put on the virtual reality glasses, and she got up and started laughing and giggling. Why? She was surrounded by a field of puppies, and she was up petting, enjoying the puppies. Why can't it be fashion? Can you actually design for fashion and for beauty? Right now everybody wears things in their ears. You got headpieces, earpieces, earphones. So why are you trying to hide your hearing aids? But in fact, just like eyeglasses, people have normal vision and are putting on eyeglasses just to show off the fashion. And then finally, why are we also not designing for social connection? Why does everything have to be particularly solo? Can you invite friends in or not? And as I like to say, when you talk about the P's or the resiliency and, learning to adapt and to cope, even if you, physically say can't move, you're stuck in a wheelchair, you can't move. It happens, right? That doesn't mean, like Experience Corps, you can't read to children. Yep. It doesn't mean you can't learn a new language.
Yep.
And even if you start to be cognitively declined, so that maybe you can't read, or you've got other accessibility issues that can come with aging, that doesn't mean you can't thrive spiritually. Put on the virtual glasses, see the world outside. And even with dementia, that doesn't mean you can't pet puppies, even if they're not there. Yep. So if you can't thrive physically, you can still thrive emotionally. And if you can't thrive emotionally or cognitively, you can still thrive spiritually. And we should think about the can-dos as opposed to the can't-dos.
Yep. Important messages, very important messages.
Yeah.
Charlotte, you just mentioned the designing component, and you mentioned the hearing aids, and I just, one other extremely important paper. You have a lot of great papers, but the characteristics and health outcomes associated with hearing loss and hearing aid use among older adults, 2019. And once again, the information here is quite staggering in terms of not just the negative, the psychosocial, the physical, and then the health outcomes between these different groups of folks. But there was the Lancet study also with dementia and hearing, and putting this all together with this again, this staggering wave that we have coming, that people say is coming in terms of dementia. we hear about the, once again, the $40,000 a shot drugs that don't do much, but it seems like simple changes here. I mean, we don't think of hearing loss as much, but these simple connections, once again, talk a little while about hearing loss, if you will, and some of what you learned here in this particular hearing aid study.
Yeah. Well, thank you so much for asking. So we've talked about a lot of different things we can focus on, transportation, newer drugs, how to build purpose and resilience. But if you can only do one thing, I would say, why don't we just start with hearing and hearing loss? First of all, it is hugely, hugely prevalent. 2/3 of people 70 and older have clinically significant hearing loss. We have an AARP study that even millennials and Gen Ys are starting to have difficulty hearing in noisy environments. We've done a lot with occupational health to reduce, exposure to loud sounds. But it's all around in your personal life, whether you were at the football games, recently, that went on with the screaming, yelling, music, concerts, headphones, even a hair dryer if you use it for 15 minutes or more, can already begin to damage, the hearing cells. So it's hugely, hugely prevalent. And yet it's the butt of jokes. You can't hear because we think of it must be a sign of aging. Well, it's preventable, if you watch noise prevention, but most importantly is you want to start correcting it early. So it turns out, as you mentioned in the Lancet Commission on Dementia, that they've identified 12 risk factors for preventable dementia. About 40% of dementia is potentially preventable. The single biggest category of preventable dementia is hearing loss, 8%. Okay, uncorrected hearing loss. Because most people wait until they're far down the curve before they do something about it. And as you mentioned, we did a large observational study looking at, medical claims, from people in their 50s, to well past, Medicare beneficiaries and the whole range. And we looked at people at 2 years, 5 years, and 10 years. So I'll just skip to the 10-year mark. But because it oftentimes takes people 6 to 7 to even 10 years before they even get their hearing checked or get a hearing aid. It turns out that 10 years of uncorrected hearing loss, you have a 52% higher risk of dementia, 41% higher risk of depression, and by the way, 29% higher risk of falls. Imagine if you got your hearing checked and a hearing aid early on in that course. If that doesn't get you, think about the cost. 10 years of uncorrected hearing costs is 46% higher healthcare costs. That's over $22,434 per person. Even at 2 years, it's almost $4,000 in difference. And I just said 2/3 of people 70 and older have clinically significant hearing loss. 47% higher risk of admission, 44% higher risk of readmission. And if you're hospitalized, a 2.5 day longer stay. And you don't access care. There's one study that has just come out that says people who have a lot of trouble hearing are 85% less likely to have a usual source of care and over 50% less likely to fill a prescription. Why? Because they can't communicate. They're feeling socially disconnected. They're isolated. They're lonely. And if you can't hear, your brain begins to lose the capacity to convert sound into hearing. Your brain becomes overwhelmed with stress of trying to communicate. And in this era of COVID, where you're wearing a mask, you can't add in the lip reading on top of that. So there's one study to say that hearing loss, uncorrected hearing loss, can cost us $133 billion in healthcare costs. So this is huge. And now the technology has really improved. We hope the draft regs for over-the-counter hearing aids are now out. So the cost might come down, especially for people with early and mild hearing loss. So that could help. More and more insurance plans are covering hearing services and hearing devices. So I'm hoping that this can make a difference as we look ahead. And as I tell people, you think you're old with a hearing aid, you are old without a hearing aid.
Mm-hmm, mm-hmm.
So, but it's the one thing you can do. Imagine, if you're working in a health system, how many of your patients may have difficulty hearing?
Yep.
How many people use amplification or devices while they're in the hospital to help communicate, help talk to your patients? How many of us, make sure that there's captioning? All those hospital videos and videos that we show people to how to manage their health equipment. Do you have captioning associated with it? These are not difficult things that could be incorporated and yet make a real difference in social connection and helping us age better.
And I'm familiar with how much I keep captioning on myself all the time, and it's amazing how much you lose in the movie or the show when you don't have it on. So, but maybe that's just me.
So actually, there's even one study that 80% of people who use captioning have normal hearing.
Yeah. There you go.
So this is, again, back to the design for all.
Yep.
It works. I mean, if you're in a noisy bar, well, maybe people aren't in noisy bars as much these days, as we have been.
Right.
But imagine, captioning so that you can watch the sports. You can imagine if you had captioning so the bartender can get your order, or in a noisy restaurant. And so it's not just the captioning, but it keeps your brain active, keeps you engaged. And most importantly, you've got to start doing it when the hearing loss is early.
Yep.
And not wait that 5 or 10 years because, it may not be as reversible.
Charlotte, what's hot for 2022? I mean, I know that you're out on the conference circuit a lot, you write a lot. Any hot topics that you could talk about, things coming up that we can know about, the scoops for AARP services or just Dr. Charlotte Yeh in general that we should be on the outlook for?
It's going to be interesting. I think seeing how we cope as we move, try to get back into the new normal. My guess is telemedicine, telehealth isn't going to go away. My hope is that if those who are in the technology sector are learning that simplicity, convenience would be really important, especially for the older adults. As I said, I've been through my own journey between myself and my family and my parents. It is fascinating to me that there's a separate app for everything, right? I've got an app for the blood pressure. I got an app for the pulse ox. I've got an app, for the fall detection. I've got an app for, getting access to health records. Everything is separated. So I would love to see as we move ahead, is there a more integrated, more of a platform-based? Secondly, are we thinking about the devices for accessibility? Vision impairment, I've mentioned hearing, all this wonderful, wonderful things you can do with voice technology. But if you're hearing impaired and it's not Bluetooth enabled, or you don't have, a hearing aid, what are, captioning or other services that could make this more accessible? So I think accessibility and this design for all is another area to think about. And thirdly, and lastly, and this is me, for my perspective, is we are doing a phenomenal job of creating technology in the home, right?
Yep.
You can turn the lights on and off. You can manage your heating system. We've got the voice technology. We've got monitoring system, remote monitors, they can monitor your behavior. And that is really, really great as long as you're at home. Yep. But one of the things we've learned in the pandemic, if you're stuck at home, that's still not a wonderful life. You want to be out and about. You want to be in the community. So I think as we emerge from the pandemic, we should think about not just independence in the home, but we should start thinking about independence on the go. How do we bring that technology so that we can venture out of the house? And if we truly are stuck at home, how do we bring the outside world into the house? And can we start thinking about mobility and think about communication, across and with others, so that we are not stuck literally or figuratively in the house?
That's that's thinking about that as we talked about the smart home a little bit on the show, but you're adding an entirely new dimension there in terms of smart home with smart connections. Seems to be able to we'll be able to address much more than just as you said. Yeah.
I'll tell you where that came from, and it was just a little story, back to personal stories.
Please.
Just about my dad. So, before the pandemic started, as I said, my mother was diagnosed with cancer, not doing well, but my nephew was getting married. My parents live in Pittsburgh. The wedding was in Milwaukee. So my 90-year-old parents got on the plane, flew to Milwaukee to go to the wedding. They had a phenomenal time. My dad danced up a storm at the wedding. I mean, they cleared the floor for him to dance. He did knee bends that even I can't do, and was dancing up. And then the next day they decided to fly back. Now, my dad has profound hearing loss. He's got a cochlear implant. He's, and at 90, now, not then, but he's learned to use a smartphone. He does FaceTime. He Zooms with his granddaughters, with dance classes. But at that time, he had just an old cell phone, that wasn't connected to his cochlear implant or his hearing aid. So they got on the plane, flew home to Pittsburgh. There was a little delay in getting off the plane. My mother, who didn't eat or drink all day, thought she was fine. Well, when they finally started to disembark, she stood up and promptly passed out. So of course the ambulance, start to, and everybody calls. So my dad tries to call me. So he calls me. I pick up the phone and I can hear the sirens and the whoop whoop in the background. And he's trying to talk to me. And he doesn't hear me because he cannot hear that I answered the phone. So he thinks there's a bad connection. He hangs up, tries again. 22 phone calls in 30 minutes. And finally, one of the EMTs took the phone, explained what was going on. My mother turned out, a little dehydration, and, fixed the problem. And that's when I said, in my dad's house, he's totally fine. He's got all of the tools, equipment. He's got all of the technology. He can get around. When he's at the wedding and there are people around him to help him, he was fine. But in the middle of crisis and emergency between people and home, he was helpless. So we need to be thinking about technology, not just in the home, but on the go.
Well, if there's one person that I'm glad is thinking about these issues, it's you, Charlotte. And you clearly, you have an amazing story, and it's going to be wonderful to continue to watch you on this front. Obviously, we're wishing you the best with your parents and that personal part of your story, but obviously everything you're doing to promote these concepts and themes at AARP is just going to be so very important in the coming years. So really wonderful story for everybody that is going to be listening to this episode across the podcast networks or watching on the YouTube channel. You've been listening to Dr. Charlotte Yeh, Chief Medical Officer, AARP Services, challenging ageism, exposing aging myths, promoting and advocating for the power of the person and personal resilience, and ultimately helping us all focus on designing for all and all on the go. Charlotte, this was really wonderful. I want to thank you for taking the time out of your schedule to do this. Thank you for everything you do and have been doing. And as we say on this show, thanks for helping to create a better tomorrow for everybody. Really, really wonderful story.
Well, thank you. It was delightful, and I'm honored to be here. Thank you.